Hi, my name is Sharon Cow, and I'm doing my presentation on antibiotic resistance, the public health problem. Antibiotic resistance is one of the biggest threats to global health, and it can affect anyone. It is rising to dangerously high levels in all parts of the world. Why does this exist in our society? It is due to the emergence of resistant bacteria. New resistance mechanisms are emerging and spreading globally, which is threatening our ability to treat common infections. As you can see in this image, there is an estimated minimum of at least 2,049,442 illnesses and 23,000 deaths caused by antibiotic resistance. How did this happen? It is mainly due to the misuse or overuse of antibiotics as well as inappropriate prescribing. Every time a person misuses antibiotics, the sensitive bacteria are killed while resistant bacteria grows and multiplies. People also try to treat viral infections with antibiotics, which is ineffective since it is only meant to treat bacterial infections. Another example of misuse is when people don't take the antibiotics for the recommended course of time, since this can cause the bacteria to mutate and become resistant to normal treatment. As for inappropriate prescribing, CDC research shows there is 1 in 3 antibiotic prescriptions that are unnecessary. Where does this happen? Antibiotic resistance can occur anywhere, whether it is a developing or developed country. Some even say that developed countries are more prone to this since it is easier to obtain antibiotics, which also means it is easier to abuse the drugs. What are the risks for the community in the future? Antibiotic resistance can cause treatable illnesses to become dangerous infections. When antibiotics don't work, it can result in longer and more complicated illnesses, more frequent doctor visits, and more deaths caused by bacterial infections. This also makes treatments more expensive since it would need stronger drugs. What are the etiological factors of this problem? As I mentioned before, misuse and overuse are some of the main factors causing this problem. Agricultural use is another factor because antibiotics are used as a growth supplement for livestock. Availability of new antibiotics and regulatory barriers are also other factors because it is hard for pharmaceutical companies to develop new antibiotics due to economic or regulatory obstacles. How to solve the public health problem. Strategy 1 is the World Health Organization's Global Action Plan on Antimicrobial Resistance. Their goal is to ensure the treatment and prevention of disease by using safe and effective medicine. This project has 5 objectives: to improve the awareness and understanding of antimicrobial resistance, to strengthen research and surveillance, to reduce incidence of infection, to optimize the use of antimicrobial medicines, and to ensure sustainable investment in countering antimicrobial resistance. Strategy 2 is CDC's Get Smart, Know When Antibiotics Work program. The CDC's website offers different tools related to preventing antibiotic-resistant infections. It can also help raise awareness of the threat of antibiotic resistance. They also try to educate the public about the importance of appropriate antibiotic prescribing and usage. How was the problem solved in other countries? The first example is Sweden and how they have low rates of antibiotic resistance. It is mainly due to their low usage of antibiotics as well as educating the citizens about the dangers of overusing it. Another example is Denmark and how they banned the use of antimicrobial growth promoters, which helped decrease the likelihood of antibiotic resistance. Public health in the future. What should be done to prevent the reoccurrence of antibiotic resistance? We can educate doctors, nurses, and other health workers to not prescribe antibiotics unless necessary. We should also ensure that antibiotics should only be used in agriculture when necessary. Another thing we can do is improve surveillance of antibiotic-resistant infections. Overall, I believe the main factors that cause antibiotic resistance is the misuse or overuse of antibiotic medication. If we were to spread awareness and educate the public about the dangers of antibiotic-resistant illnesses, then we may be able to see a future where antibiotic resistance would not be a huge global issue. This is a list of all the references I used throughout my slides, and this also concludes my presentation. Thank you.